All right, good afternoon. Welcome. Great to see so many people here. My name's Tim Staton. I'm a professor at the School of Social Work here at UBC, and I'm the co-chair with Patsy George of the Splane Lecture Organizing Committee. So this is, I have to ask her every year, this is our 18th Splane lecture. Patsy's going to share a little bit of the history, 17th, sorry, she's correcting me already. But we've had some fabulous speakers, but we are so excited about tonight's lecture. The way this works is Patsy and Samir, also from the UN Association, we toss around ideas, we ask people for suggestions, and I saw a piece in the paper about your impending retirement, Lisa. I thought, wow, there isn't any issue that's more important right now in our community, and so maybe I can talk her into coming. And she was easy to talk into it. So we're really, really pleased she could join us. And I didn't realize it's somewhat sadly the 8th year since declaring the emergency as of yesterday, the health emergency. So, and I guess as we'll hear, we're not really going in the right direction yet, are we? So a really important lecture. We're thrilled to have everyone here. I just want to start by acknowledging that we're meeting today on the unceded territory of the Musqueam people, and we thank them for being able to live, learn, and work on their beautiful, permanently occupied territory. So I'm going to be your MC for tonight, and we just have a few introductory remarks from some folks before we move into our main lecture. So I'm just really thrilled to have Dean Crouston, the new dean of new to us. They've been here a long time, but she's finished her first year and appears to be in reasonable shape after that. So we're really grateful that she could come out and join us tonight and say a few words. So Dean Crouston.
Thanks so much, Tim. It's wonderful to be here with all of you today. As you heard, I'm Claire Haru-Croston, and still the relatively new Dean of the Faculty of Arts. It's a year and about 4 months now, so I'm doing many things for the second time, which is kind of exciting since I came last January, although this is my first time with you at the Splane Lecture, which is a wonderful series, the 17th lecture, I guess. So thank you very much for inviting me to say a few words. It's a great honor to be here to welcome you to the Splane Lecture in Social Policy and to welcome our former BC Chief Coroner, Lisa Lapointe, to our campus back for the first time, as I just learned as a speaker after completing a degree in law here a few years ago. As Dean of Arts, I strongly believe in the vital importance of engaging with community issues, and as Tim was just emphasizing, none is more important than the toxic drug crisis that has seen so much tragedy, which is ongoing, and which, as we know, I'm thinking of our land acknowledgement, has disproportionate impact on First Nations communities. In my relatively short time, as Dean, I've become aware of all that the School of Social Work does to engage the community and to lead on community engagement and making people aware of these important issues. The School of Social Work is a leader not just in the Faculty of Arts, but on our campus, and that makes me very proud as Dean, so thank you for all the work that you do. And also, as we know, our own campus at UBC is by no means immune to the toxic drug crisis, and so this makes it all the more important that our students, staff, and faculty are informed and engaged in tackling this issue. So I'm really looking forward to hearing today's lecture with you. And so I know we have a long list of intros, so let me pass it over to Leah Caragata, the director of the School of Social Work, and thank her for a wonderful first year as director of the school. Thank you, Lisa.
Good afternoon, everybody. I'm Leah Caragata, and if Claire gets to claim that she's the still new Dean of Arts, I really get to claim that I'm the still new director of the school. I'm doing just about everything for my first time, and and sometimes that's telling and sometimes not so much. But I'm really pleased to be able to welcome people here today. As Claire indicated, the opioid crisis affects us all in a variety of ways, whether personally or professionally, and certainly within the School of Social Work. It is the work that many of our graduates do, whether they intend to do that or not. And we actually have an important new initiative that we're working on right now to develop a certificate program in mental health and addictions, so that we can extend our learning opportunities beyond those people who are doing our degree programs. So it is a crisis. It's a crisis 8 years old and much longer. So we're very appreciative of the fact that we have the opportunity to hear from Lisa today to talk about the crisis, talk about the work that she's done, and to really get us kind of thinking about what more we all need to do to address this extraordinary moment in time that seems to endure. So thank you, and with that I will pass the microphone back to you. Thank you, Patsy. We're very grateful to have continuing to support us over so many years.
My name is Patsy George, and I represent the United Nations Association of Canada, Vancouver branch. We have been a partner in sponsoring this annual event. So this year, as you heard, marks the 17th year of Splane lecture. I do want to thank the Musqueam Nation for giving us this opportunity to gather in their unceded and ancestral territories and continue to work for reconciliation. In September of 2006, when Richard Splane, big to many of us, turned 90 years old, those of us who knew him and respected his contribution to Canada, the United Nations, and the Global South, decided to give him a birthday present, an ongoing annual lecture on social policy in his name to honor him. Thus, the first lecture started in 2006, and this year we are marking the 17th year. Until his death in 2015 at the age of 100, Dick blessed us with his presence, along with his equally active wife, Verna, year after year at these lectures and discussions. Who was Dick Splane? You will have a chance to read about him in the program, but let me give you a short history. Born in Alberta, with degrees from McMaster University, Toronto, and London School of Economics, he not only served as a pilot during the Second World War in England, but also became the Assistant Deputy Minister in the federal government in Ottawa. He was a chief proponent of Canada Assistance Plan, which provided 50% of funds to the provinces for health, education, and social services. Don't we wish we still had it? Dick became a professor of international development upon retirement from public service, with special interest in the Global South. He served on the board of UNICEF, Mosaic here in Vancouver, World Federalist Movement, and of course served as the president of the United Nations Association here in Vancouver. I met him first as a student in 1964 in Ottawa, and when I came to Vancouver in 75, he connected me to a number of organizations to do volunteer work and encouraged me to take leadership roles. So I served as president of BC Association of Social Workers, following him, first and the only woman of color ever served in that capacity. We have a long way to go. He encouraged me to attend several international conferences at the United Nations and in other parts of the world, even making joint presentations. Dick was one of those people who made you understand and believe that we are one world and we are responsible for each other. I want to acknowledge the presence of Samir Ismail, the current president of the United Nations Association in Canada, Vancouver branch, George Somerville, past president and a former UN staff at the peacekeeping operations, Rocio Gaudimer. I don't see her. Oh, over there, thank you. The treasurer and other UN staff from FAO, all committed to the work of the UN. A special hello and welcome to all those who are with us today, who are friends of both Dick and Verna, who have encouraged us to continue these annual events. I see 2-3 people that I recognize who were very close friends with Dick and Verna. As a social policy expert, Dick chose the route of public service and academic work to make Canada a better place for ordinary people, people with special needs, seniors, unemployed, and newcomers. He truly believed in engaging the public, particularly the students, in public policy discussions where issues of social justice, human rights, and peace were discussed. He believed that we can and we must influence the public policy development, not only in our province, but also across Canada. During the past 16 years of these lectures, we've been able to focus on a number of policy issues close to Dick's heart, namely immigration, poverty eradication, human rights, pension reform, rights of Indigenous people of Canada, homelessness, policies to protect children locally and globally, hunger and food security issues, seniors, health policies related to caring for them, racism, and the need for reparation for those who were brought to Canada as slaves. Today we have an expert who will inform us on the changes needed to deal with a toxic drug crisis in our communities. Both Dick and Verna Splane promoted the notion that public policy included both economic and social policy. Economic development without social development will not bring equality and social justice, they taught us. Dick's legacy will remain the way he was instrumental in shaping the Canadian social policy. We need people with Dick's vision and these social policy discussions on an ongoing basis to help us to get there. So many of us are grateful that Dick and Verna lived among us and promoted progressive social policies to break the cycle of poverty, to improve and strengthen the social security and legal and health systems. We have a lot of work to do. Dick's commitment to improving the lives of ordinary people and the lives of people all around the world lives after him through these lectures. May he rest in peace. Thank you.
Thank you, Patsy. And I think Dick would be very pleased about tonight's lecture. And like him, a career civil servant who's committed to improving the lives of the people of this province. And so I'm really pleased to welcome our guest speaker for this evening, Lisa Lapointe, who you probably know at this point is our former coroner until February, so very recent retired. When we were planning this, she said, well, you know I'm going to be retired. I said, oh, great, you can say what you really think. So Lisa is a graduate of UBC School of Law School. In 1995, she started her work in the civil service. She's worked as assistant deputy coroner from 2003. She's also worked as the assistant deputy warden at Vancouver Regional Correction Centre in Victoria before moving to her role of director of programs and strategic services. In 2008, she was appointed as the director of the province's civil forfeiture office. So a really broad experience across the civil service. And of course, what brings us together today is her role as chief coroner, which she served in from 2011 until last month. She was responsible for overseeing the independent investigation of 14,000 deaths a year reported to the Coroners Service, including children's deaths and deaths reviewed at inquest by the Coroners Service death review panels. She's a grandmother and a mother, and her free time enjoys running and cycling and yoga and spending time with her expanding family. She's chair of the British Columbia Institute of Technology's Forensic Science and Technology Program Advisory Committee, and the former chair of the Canadian Forum of Chief Coroners and Chief Medical Examiners. In 2013, she received the Queen Elizabeth II Diamond Jubilee Medal in acknowledgement of her dedication and expertise to public service for over 20 years. In 2018, under Lisa's leadership, the Coroners Service was awarded the inaugural Premier's Award for Evidence-Based Design for its analysis and timely reporting of data on illicit drug overdoses in the midst of a public health emergency. So I'm really pleased to share it. I think when we were talking about this, one of the things that impressed me, she immediately went to the data. And so when I was researching her background, maybe I'm just weird, but I can't name another chief coroner in the history of BC. But a lot of us know Lisa's name. And the reason we know her name is because she's spoken up. And she's spoken strongly about this emergency and how we need to act. And wasn't afraid to call out the government for not acting on that. So I think we're going to hear from someone who certainly is knowledgeable about our topic. And if I can figure out how to get her slideshows up, we'll move right on to her. So Lisa, welcome. Okay. I'm supposed to remind you to turn your mic on.
I did.
Okay.
Okay. All right. Well, thank you so much. And it's such an honor to be here tonight. Thank you all for coming. As Tim mentioned, I retired on February 16th. It was a big red letter day for me. And this is my first speaking engagement, my first time sort of back at work since then. So there's been a lot of cleaning closets and pondering what to do next. And it's actually been quite lovely. I highly recommend retirement. But this is a very serious topic and something that's very near and dear to my heart. And anytime I'm invited to speak on this topic, I'm very happy to do so. And particularly for the Richard B. Splane Lecture in Social Policy, I read up a little bit on Richard Splane, and certainly a very accomplished, caring, and committed person who made a real positive difference in this country. And I think we'd all like to be remembered as somebody like that. So it's an honor to be speaking at his lecture. I also want to respectfully acknowledge that we're gathered on the traditional ancestral and unceded territory of the Musqueam First Nation, and I'm very grateful for the opportunity to be present on these beautiful lands. Illicit drug toxicity is the leading cause of death in British Columbia for those aged 10 to 59. And that's a pretty shocking thing to say for a province like British Columbia, which is so rich in so many ways and so forward-thinking in so many ways. And yet for the last 2 years, more people have died, more people aged 10 to 59 have died from illicit drug toxicity than from any other cause of death in our province. It's quite a shocking statistic. This is the BC CDC slide that shows you, you can see there, people from 10 to 18 years, 19 to 39 years, and 40 to 59 years. All leading cause of death is illicit drug toxicity. And then for other young people, it's other unnatural causes, suicide, accidents. For older people, then some natural disease comes in. So from age 60 onwards, it's natural diseases and far less due to illicit drug toxicity. But illicit drug toxicity is the leading unnatural cause of death across all age groups, and the leading cause of death for the 10 to 59. And over 40,000 people have died in Canada in the last 10 years. Over 14,000 people have died in our province since 2013 when the public health emergency was declared. And of course, although we're talking about numbers, and I will be talking about lots of data because it's really important to me that everybody understand this crisis and the context, every one of those numbers is a person. And I know that many people either here tonight or who will listen to the recording will have lost somebody they know and loved, a son or a daughter or a friend, a parent, a sibling. And I do sincerely want to extend my heartfelt condolences to all of those in our province who have lost somebody, because thousands and thousands of us have been touched by the loss of a cherished loved one. And their loss is our collective loss. We have lost far too many people to this preventable cause of death. So, in the beginning, I think it's important to go back. Prior to 2013, 2012, we routinely, sadly, saw about 350 deaths in our province on an annual basis due to drug toxicity. And because that number was fairly stable, we sadly more or less accepted that. We didn't see any big changes. And then in 2012 was the very first time we saw illicit fentanyl enter the market. 3 men in the Vancouver Lower Mainland area who normally used oxycodone were found to have fentanyl in their systems. And I remember the provincial toxicologist calling me up and saying, "This is really different. We have not seen this before." He noted it right away. From there on, deaths just started to climb and climb and climb. Deaths and toxic drug events. And Dr. Perry Kendall, who was then our provincial health officer, said, this is a provincial health emergency. We need to respond in a big way. And he declared that provincial health emergency April 15th, 2013. And as Tim said, that the 8th anniversary of that declaration was yesterday. And I'll talk a little bit more about the measures. So you can see there, 2012, 2013, 2014, 2015, a significant increase in the number of people dying in our province. This is where we are today, and this data is from the BC Coroners Service public website. Anybody can go on there. There's all sorts of different pieces of data there. And what I really wanted to draw your attention to was both the numbers of death, and you can see the increase in death. 2019, there was a fairly sharp decline. That was the take-home naloxone program, and many of you are probably familiar with that. Prior to that time, it was introduced about a year or two before that. Naloxone was only available in emergency rooms and to paramedics. And then because so many people were dying, the province initiated the take-home naloxone program. Anybody can be trained to use naloxone. Any of you can carry naloxone with you anywhere you go. And really thousands of toxic drug events have been reversed by frontline service providers, people who work in the downtown east side, people who work in other areas of the province, who have just learned to do that out of the goodness of their heart. It's been quite a remarkable program. But 2020 with the pandemic, and for a number of reasons, which I'll talk about as we go on, the deaths have increased and increased and increased. And in 2023, the death rate was 46.4 per 100,000, which is a shocking rate. The Coroners Service is projecting 40.1. We only have data to the end of February so far this year. These are BC Ambulance drug poisoning calls because as Chief Coroner, I was responsible for the investigation of death. But of course, we knew our colleagues at the BC Ambulance Service were also responding and also impacted in a hugely significant way as a result of the crisis. And you can see the increase over time there. 2016, 19,000 drug poisoning calls. So these are how they code the toxic drug calls that they get. Up until 2023, 42,172. And so, a significant increase, or I think it was 115% increase over those years. And these don't include all of the people whose toxic drug events are reversed by those working in the street fronts and the Good Samaritans who are helping. So it's just a significant, almost unimaginable impact across our province. 42,000 BC ambulance calls last year for drug poisoning events, and these are toxic drug poisonings. I wanted to give you a little bit of context. So you might remember I pointed out that provincial rate of death in 2023 was 46.4 per 100,000, and there is a common misperception that this is a downtown east side problem, that really the downtown east side is where these deaths are happening, and if we could only do something about the downtown east side, this problem would go away. And I think it's really important to point out that, in fact, look at the Northern Health Authority, the chart down on the bottom, my right, I don't know what it's your right there. And you will see that the Northern Health Authority in 2023 had a rate of 67 per 100,000. The Northern Health Authority has the highest rate of death in our province. And it's also worth pointing out to you, and I couldn't include all of the slides here, but on the BC Coroners Service website also shows the rate of death in the local health authorities. Vancouver Centre North, which is the neighborhood of the downtown east side, has a rate of death of 552 per 100,000. It is by far the most heavily impacted neighborhood in our province. Very small neighborhood, a large number of vulnerable people. So significant impact there. But the next highest rate of death in our province is Hope, BC, 123. Alberni-Clayoquot is third with 102, Terrace, 93, and Greater Campbell River, 93.8. Terrace is 93.9, Greater Campbell River is 93.8. So this myth that this is a downtown east side Vancouver problem, it is not. And it's so important that we understand the realities of this crisis in our province. If we were able to prevent every death in the downtown east side that happened in 2023, 389 people died in the downtown east side of drug toxicity in 2023, we would still have had 2,100 deaths in our province. So this is very much a provincial crisis. It impacts all towns, all neighborhoods, all walks of life, all socioeconomic levels. People don't see that because what the media show, and I don't blame them, it's where they have access, they always show the downtown east side, and they show somebody injecting in a back alley because the media don't have access to what my coroners were seeing, which is the suburban homes, the condos in downtown, the rural communities, the family who comes home and finds their child. That's the reality, but nobody sees those pictures. So it's hard for the public to really understand that, and it's really important to know that. The other thing that's really important to understand, I call this again myth busting, that sense that people are dying outside, people are dying in alleys and sidewalks. Not true. And any of you who've been following this at all, pushing back against those stereotypes, the vast majority of people are dying inside, in private residences. In the downtown east side, it's more SROs, but still inside where they're living. And that's to a great extent why people are dying. I'll talk about this a little bit further on. The stigma around drug use. People hide their drug use. Nobody wants to talk about it, so they're using it at home. They don't want people to know. They may have a relapse. They don't want their family to be disappointed or their friends to be disappointed, and so they use alone. They suffer the effects of the toxicity of the drugs, and they can't reverse that event, and they die. So using alone is a huge problem. Most people who die are alone in a private residence. Very rare to die outside. And I can't remember if I mentioned, 80% of those who die are male, and most deaths occur between those 30 and 59. So these are the drugs involved, and you can see from this chart, and this is why we call this an opioid crisis. It's really a fentanyl crisis. We first saw fentanyl in 2012, and since that time, fentanyl has been responsible for the deaths. We see there, over 80% in all of the years starting in 2017. And what is also interesting, you will see, is these numbers add up to way more than 100% because most deaths are mixed drug toxicity. So it's fentanyl and cocaine, methamphetamines, benzodiazepines. The illicit market, we all know, is unregulated, so there's no quality control. So it's just a toxic mess, and people may think they're buying one thing and they're actually getting something else. Fentanyl is, though, now very much the drug of choice for most opioid users because opioids, you do build up a tolerance. There is virtually no heroin in if only we were, the good old days, honestly, where people could access heroin. Fentanyl is a chemical that's made from precursors that can be ordered over the internet. There's a myth that it all comes in from China, and initially most of the fentanyl in our province did come in from China, but now BC is very much a producer of fentanyl. Whereas heroin, I think you all know, heroin comes actually poppy plants, and you have to grow them and dry them, and transporting them was not as easy because it was a larger thing to transport, to bring in. Fentanyl, tiny little envelope. It's impossible for the border services, BC, the Canadian Mail, Canada Post, to prevent that coming in. And then now, as I say, you can order the precursors off the internet, and so there's lots of labs in BC, and I use the word lab very loosely. I've been in some of those labs. They are somebody's kitchen, somebody's basement, somebody's back room. They're using the little blenders that you make your smoothie in the morning. There's no quality control, obviously, because we can see why so many people are dying. So I use the word lab very, very loosely. But these are the drugs that we see most often, and most often mixed drug overdose. And again, I just put this in here. There's fentanyl. It's just another way of illustrating that fentanyl is by far the drug that we find the most. The 2023 results will increase as more toxicology results come in. They're still waiting for all of the results of the postmortem tests. All right. Mode of consumption. Again, the myth that people are IV drug users. That is just not the case any longer. The vast majority of people smoke their drugs. Interestingly, we do have in our province, there are some supervised consumption sites. You're probably familiar with in the east side, our supervised consumption sites. There's overdose prevention sites, which one of the former provincial health ministers very bravely opened at the beginning of this crisis. There's 47 of those across the province. Many communities will not have one. They will not allow an overdose prevention site in their community. And only 19 of the 47 provide inhalation services. So despite the fact that the vast majority of people smoke their drugs, there's only 19 places in the province where you can do that in a supervised environment, where if you get in trouble, there will be a medical person there to reverse that. Again, you can see that's the blue line there. Injection is the dark blue line, and you can see in the middle pretty stable, whereas the light blue line, smoking way higher, 75% of those who died smoked. And this is similar to data gathered qualitative from people with lived and living experience. So I do want to also mention this. I don't presume to speak for the First Nations community, but it's really important to me that we recognize this, and certainly we at the Coroners Service worked very closely with the First Nations Health Authority to acknowledge that Indigenous people are disproportionately impacted in a huge way by the drug toxicity crisis, and often, it's because of the impacts of colonialism and the enduring racism, the root causes of substance use. All of those things contribute to the substance use crisis amongst folks in our communities, and certainly the impacts on First Nations have been incredibly disturbing. This is from the First Nations Health Authority website. In 2022, which is the latest year for which they've posted data, 24.7 increase in toxic drug poisoning deaths for First Nations people, and First Nations people died at a rate 6 times more than other BC residents. First Nations women died at a rate 11.9 times other female BC residents. So really disproportionately impacted in a very, very tragic way. And the First Nations Health Authority has done incredible work at trying to dispel the stigma and address some of the root causes and provide really meaningful, positive support for people in community. So the topic of the lecture is advice to stop the dying. And there are things that we can do to make a meaningful difference. And as Tim pointed out, and as you saw from one of the slides, the deaths have continued to increase year after year after year after year. And there are things that could be done that aren't done. And I think you might be surprised at some of the things that aren't being done, sadly. So as Chief Coroner, the Coroners Service can hold death review panels, and that's where we bring together subject matter experts to come together. We basically say once the door is closed, it's protected by Coroners Act protects their confidentiality of what they say, and to speak freely based on their experience on what measures need to be taken to reduce the dying. So we held death review panels in 2018, 2022, and 2023. The Canadian Association of Chiefs of Police had a special purpose committee on decrim in 2020. Health Canada put together an expert task force on substance use in 2021. And our own province put together a BC Select Standing Committee on Health in 2022. That was an all-party committee and heard over 300 witnesses, over 700 pieces of evidence. It was quite an interesting, very valuable experience. In my mind, these are the most influential groups to date, but there certainly are more. Our provincial health officer just put out a report a couple of months ago, and our auditor general just put out a report about 3 weeks ago. So there's still more work being done. But I just want to give you a very brief overview about what they found. So we did the first death review panel in 2018, and the findings they were interesting. A substantial number of the deaths occurred among persons with recent health care and or BC Corrections involvement. Most deaths occurred among persons using alone, and I want you to remember that. Using alone is a very, very risky thing, and I'll tell you why. I want you to remember that later. Most deaths occurred in private residences. We've talked about that. Many of those who died had sought treatment in the past and experienced relapses, and this was the most interesting and alarming finding. There are no provincial regulations for evidence-based standards for addiction treatment or for reporting outcomes. There are no standards for addictions treatment in our province. None. So I could start a treatment center tomorrow. Any of you could start a treatment center as long as you meet the fire code regulations and you meet the zoning requirements. But the care that you provide is what you think is the best, because there are no standards in our province for what might be important. And there's no reporting requirements. So we don't know how many people have been through treatment in our province. We don't know how many of them have completed their treatment program. We don't know how many have survived 30 days, 60 days, 90 days, 5 years, 10 years. There's no data. We don't know which programs are more valuable than others. And I was speaking about this with somebody at the Ministry of Mental Health and Addictions shortly after we made this recommendation. And she said, yeah, some of them just do group therapy, and some of them have psychoanalysts and, addictions medicine specialists. And I said, and we don't know which work better. We don't know. There is no data. The really tragic thing is that families are mortgaging their homes to put their loved ones into treatment facilities, believing that these are accredited based on evidence, based on research. They are not. What boggles my mind is I'm an animal lover. I could not set up a facility in my neighborhood to treat animals because I love animals and I want to do the right thing. But people, and it's often people who want to do the right thing, setting up a treatment facility based on what they think is right. So it's kind of alarming that in the provincial health crisis, where 14,000 people have died, we still have no standards in our province for treatment. Sorry, I went on a little bit about that, but it's quite shocking. So the recommendations were to regulate and oversee treatment and recovery programs, to ensure that they provide evidence-based quality care and that outcomes are closely monitored. and the need to expand access to evidence-based addiction care across the continuum. For so long, addictions care was in the nonprofit and the profit agencies. There are still massive lineups for anything that's publicly funded. If it's a detox program or a provincially funded program, there are massive wait times. So the not-for-profit, well-intentioned, good-hearted, and then the for-profit, there's a lot of the private, the Edgewoods, who charge significant amounts of money. We don't know what their results are. None of that is reported. I was at a conference once, and one of the not-for-profit person was saying, because somebody had been criticizing their approach, which was complete abstinence. And that can be very dangerous because in as little as 3 days, you can lose your tolerance for opioids. So if somebody's in a complete abstinence program, comes out, relapses, that's often the most dangerous period. That's often when people die because they've lost their tolerance for the opioid. And she said, well, anything is better than nothing. And I said, you can't say that because anything is not better than nothing. If somebody goes through the program and, like I say, has now lost their tolerance and goes, maybe some of these abstinence-based programs are actually contributing to the increase in death. But we don't know because there's no data. That's enough of me saying that. In 2022, second death review panel. So this time, the panel members, and these are the Provincial Health Officer's Office, the Chief Medical Officer from the health authorities, police were represented, addictions medicine specialists, people with lived and living experience. So these are people who we don't, not people off the street or just people who have an interesting opinion. These are experts in their field. The drug toxicity deaths had continued to increase. The supply was increasingly toxic. So fentanyl, carfentanil, sometimes xylazine, benzodiazepines, which are a sedative, which really complicate the response to an opioid, a toxic drug event. Indigenous people disproportionately affected, smoking, most common method of consumption, all of these things that I've mentioned. Strong concurrence of substance use and mental health disorders. Many people had had recent contact with health professionals, so they had been in emergency for a toxic drug event or something else. And obviously, people living in poverty and with housing instability are particularly vulnerable. There's a lot of trauma in our communities that's not being addressed. Multiple substances detected in the majority of deaths. Very few of the decedents engaged with substance use disorder treatment services. And as we saw, the deaths occur across the province, urban, rural, remote communities. There's no community in our province that has not been touched by this crisis. And so this panel recommended, and if their report is on the website, our Coroners Service website. Certainly encourage you to read it. Urgent, urgent, urgent. I almost, every third word in that report was urgent, 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 because of at that time, and continues to be, 6 or 7 people dying every single day, and at that time, as now, drug toxicity is the leading cause of death in our province for those aged 10 to 59. So this real sense of urgency, we need to do something. Develop a plan. What is your plan, province? What is your plan, Ministry of Mental Health and Addictions? Establish an evidence-based continuum of care. And all of those things that we said in 2018 that you didn't do, implementing the reporting of outcomes for treatment facilities, and ensuring that there are standards for treatment in our province, and in fact bringing all of that back into the fold of the province, away from the profits, the for-profits and the not-for-profits. None of that had happened. So do those things too. So that was the second death review panel. None of those things got done either. I wanted to bring your attention to this. The Canadian Association of Chiefs of Police Special Purpose Committee on the Decriminalization Survey spelled that wrong of illicit drugs in July 2020. And this was the Canadian Association of Chiefs of Police. So a fairly, there are some very progressive thinkers, but a fairly law and order approach. And acknowledged in their report, merely arresting individuals for simple possession of illicit drugs has proven to be ineffective. So that's what we've been doing for decades. That has not been effective. Evidence suggests, and all of this is verbatim from their report, Evidence suggests, and numerous Canadian health leaders support decriminalization for simple possession as an effective way to reduce the public health and public safety harms associated with substance use. The CACP do not support the legalization of drugs such as cocaine, methamphetamine, or opioids. However, they do support evidence-based medical treatment that includes a safe supply. So this is the Canadian Association of Chiefs of Police in 2020 endorsing both decriminalization, and the provision of a prescribed safer supply. They saw it as part of the medical treatment. And acknowledging that health is best positioned to address problematic substance use and not the police. And they very clearly said, we cannot arrest our way out of this crisis. And that's a quote that the chairperson used. The Health Canada Expert Task Force on Substance Abuse, again, there's a reason why I'm bringing all these to your attention, said the same thing. They had police on theirs, they had academics, they had research, frontline addiction medicine specialists. It is time for a paradigm shift in policy. Bold actions are urgently needed, including decriminalization, the development of a single public health framework that regulates all substances, and the expansion of safer supply, and frame the strategy as health promotion approach. So not the historic approach, which is the very criminalization approach, and that there need to be national standards to assure that there are standards for the array of services and supports that people in Canada who use substances should be able to access. So there are no standards in any of the provinces. It's not just a BC problem. There are no standards for what works best. Every province, if you're paying attention to any of this at all, you'll see it's become very political. There's a lot of ideology, but there are to date no standards for evidence-based standards for treatment. And then the committee that I talked about, the all-party Select Standing Committee on Health in November 2022. Just want to flip to my notes and make sure I don't miss anything here. Okay. Similar recommendations. Define the goals, metrics, and timelines. So emphasizing what the Coroners Service panels had said. Greater availability of harm reduction services. Urgent collaboration to scale up access to safer supply. There's a theme. Implement people who use or have used drugs into the development and implementation of new policies and programs. And it's really interesting how often these programs are developed without input from those who are impacted the most. What would make a difference to you, person, who's struggling with substance use? What would help you to recover? Would putting you in jail be helpful? Ask people. Most people would say that isn't helpful, but that's a piece that's really been missed, is that people with lived and living experience who are most impacted, there's a lot of people have insight into what the challenges that they're facing and the supports that would help them. Very seldom are they engaged in that process. To substantially increase publicly funded and accredited treatment and recovery beds, create a new statutory framework to collect and evaluate information on outcomes. Again, that's what I was talking about, that dearth of outcome data. We just don't know what works and for whom. And then evaluate whether alternative models of providing a safer supply of substance should be trialed. I don't want to get into the politics of this, but this was all party. So members of every party, including the provincial opposition, was on this committee, and all of them, it was a very interesting experience presenting to this committee, because they were very caring, they were very committed, and there was a real sense of urgency. What do we need to do? What do we need to do? What do we need to do? So here's the general consensus, and that was the reason I wanted to, take the time to go over the various ones there. Substance use is a public health issue. So all of those groups came to a consensus that the Health Canada, the BC All Party, the Canadian Association of Chiefs of Police, and the 3 BC Death Review panels, substance use is a public health issue. Greater access to treatment is needed. Decriminalization of possession for personal use needs to happen. Implement some form of safer supply. Now, the police were very much in support of safer supply, a medical model, prescribed safer supply, and I'll talk a little bit about some other models that have been suggested, and address the stigma. And that is to my mind, that is the biggest challenge we face in responding to this crisis. There is so much stigma around drug use. It is the leading cause of death in our province. Why aren't we all outraged? But there are so many things to be outraged about right now. People are facing, affordability issues. People can't find housing. People can't make ends meet. Understandable. And it seems to often go under the radar that 6 or 7 people are dying every day in our province as a result of toxic illicit drugs. And 14,000 in the last 8 years, those 14,000 have left ripples through their communities. So, tens of thousands of people impacted. Everybody knows somebody or knows somebody, whose loved one has been impacted by this crisis. So this is what BC has done, funding for beds. And beds sounds good, but what is a bed? I have asked the Deputy Minister of Mental Health and Addictions, what is a bed? Well, it's just a term that they use to measure. It's not an actual bed. How many people are impacted when you fund a bed? So you will frequently hear announcements, we're funding 92 new beds. No, sorry, you will hear announcements, we are funding 92 beds. Sometimes they're new beds, sometimes they're existing beds that the government is now funding. So there's not been a massive increase in beds. We don't know, and I always sound so negative about this, and I hate that I do, but we don't know what a bed means. We don't know if we establish a bed, how many people does that help? 1 person in a year, 2 people, 5 people, 10 people, for how long? So we hear about beds. The announcement of beds is always portrayed as a really great thing. What we never hear about are the people. How many people will benefit from these beds, and in what ways? Funding for Foundry Centers for youth aged 12 to 24. Again, excellent. Families are desperately looking for resources for their youth if they are experiencing mental health challenges or substance use challenges, a number of other issues. It won't make a big difference in the short term or the medium term. Maybe in the very long term it will. In this crisis, only 1.25% of those who die are under 19. So the province is putting a lot of money in the foundries, and those are good, I think. Again, there's no evaluation. It sounds like a good thing, but it's not addressing this crisis because 1.25% of those who die are under 19. That isn't helping the 7 people dying every day. But in July 2021, the Ministry of Mental Health and Addictions sent out a directive to all of the health authorities to initiate a prescribed safer supply program. And that was a positive step. When I read the directive, it didn't have any targets. It didn't say how many people they should hope to impact in what period of time. So to my mind, when you set up a program, you should have some goals for that program. How many people would we like to see on safer supply in the first year? Year 1, year 2, year 3, and maybe the first year is going to be modest. It's a new program, and then build up over time. You have to train physicians. There has to be, there has to be infrastructure established. No targets at all, and then the 3-year decriminalization pilot, and I'm going to go into both of those a little bit more. And that started January 31, 2023, and that's in place to January 31st, 2026. So let's go back for a minute to safer supply. Why do we need safer supply? And recently, the provincial health officer put out a report, and she suggested that we call it alternative supply, I think. She liked that better, I think that makes sense to me too. It respects the needs, dignity, and desires of people who use drugs. People who use drugs are still people who have opinions and have desires and have challenges and need dignity. The current system allows no dignity for people who are using drugs for whatever reason. And having worked in this field for so many years, Tim mentioned, I don't know if he mentioned it, I started as a field coroner in 1995, and I responded to scenes of death across the lower South Vancouver Island for 7 years. I saw hundreds of toxic drug events. The stereotypes of, I hear the way some people talk in the media, and I know anybody in this room is not feeling that way, or you probably wouldn't be here, as if they don't matter. They don't matter anyway. They were all people who had a past, they had families, they had pets, they had skills, they had hopes, they had dreams. They are all real people who all deserve to live. So it's recognizing that. It reduced to eliminate the reliance on the unregulated, profit-driven, toxic, illicit market. So there's those who say, and I'll talk about this a bit later, why would we give drugs to drug addicts? This is the language that we hear, which I really find disrespectful. Because if we don't, who are we supporting? Organized crime. It's not, the choice is not don't provide a safer supply versus don't use drugs. We know people are using drugs. There needs to be an approach to that too. We're not going to disregard prevention. Prevention's incredibly important, but by not providing a safer supply, organized crime is the only one who benefits. It supports health, mental health, economic stability, and relationships, obviously. And I don't know if you noticed, but a recent study published in the British Medical Journal of 5,000 people with opioid use disorder in BC who were prescribed a 1 or more days supply of opioids as part of the risk mitigation guidance were 61% less likely to die in the following week. So it's early days, and it's evidence generating. So, there is not a lot of data about safer supply, but those programs are being very carefully evaluated. There's a safer program here in Vancouver. There's a safer program in Victoria. They are very carefully analyzing the results for those who are able to access safer supply, and it's all been incredibly promising. The current model is prescriber-based, which is a bit of a challenge because there are 1 million people in our province without a family doctor. So there aren't a lot of clinicians out there who want to take on the additional work of prescribing safer supply. And many clinicians really struggle with it because it feels like they're afraid. If I prescribe something to somebody who gives it to somebody else and they die, I'm responsible. I don't want to be responsible for that. Those are real fears that have to be acknowledged. And then concerns about diversion. That one of the challenges is that people were receiving hydromorphone, which is one of the few drugs it's an opioid that you can get as part of the safer supply program. Hydromorphone does not meet the needs of somebody who's using fentanyl. It's a much less potent drug. So the allegations are that people were selling their hydromorphone in order to buy what they really wanted, and the fear was that people who were naive to opioids would buy the diverted hydromorphone and die. We don't have any data, so there are a lot of anecdotes. The data we have suggests that that's not happening in any significant way. The hydromorphone has not shown up in any significant amounts in postmortem toxicology tests done by the Coroners Service. Less than 3% of deaths detected hydromorphone. In virtually 3 cases, I think, in the last 8 years, has hydromorphone been the cause of death. And in 2 of those cases, it was a person's own prescribed hydromorphone, that they took too much of it, was not diverted. But hydromorphone has always been trafficked, diverted in our province. 86% of the hydromorphone prescribed in our province is for people experiencing severe pain, cancer patients, people in palliative care. 14% is prescribed under the Safer Supply program. And now, I just saw a bulletin last week, counterfeit hydromorphone has hit the market, which we knew the organized crime would not be far behind. And the fear is, of course, that people will buy hydromorphone thinking it's safe because it's a prescribed They think they're buying the safer supply, that is a safe thing to use, and these counterfeit hydromorphones will be just like everything else that is on the market. It'll be a toxic mix. So really frightening new information that we're just learning about. And it's not a safer supply versus treatment. And this is one of the things that some of those who are really concerned about safer supply, really worried about it. No, treatment. Yes, treatment. And yes, safer supply. Because we don't have enough treatment beds in our province right now. We did a third death review panel, and I'll show you what they found. But while people are waiting for treatment, they are dying because we just don't have the infrastructure. So we need to have the mental health supports. We need to have the health care. We need to have the find people housing, the supports for families, all of the things that people are looking for and just can't access because our medical system is very challenged right now. Those experiencing problematic substance use aren't any different. They're facing the same barriers as everybody else and trying to access some form of help for what they're struggling with. So it's not a dichotomy. Absolutely safer supply and treatment while we build up the treatment system. So decriminalization, again, why? Why? That seems like a contradiction. If so many people are dying as a result of illicit drugs, why do we want to decriminalize it? And again, as we saw in all of those panels, that acknowledgement that substance use is a health issue and that making somebody feel worse because of their health condition is unlikely to have a positive impact on their life. Giving somebody a criminal record is unlikely to help them in the long run. So even our province's own submission for an exemption to the Controlled Drugs and Substances Act said that criminalization of simple possession remains a significant impediment to our ability to implement a comprehensive public health response. There's a lot of fear, there's a lot of stigma. People don't want to come forward, they don't want to be arrested, they don't want to be stigmatized, they don't want to lose their job, they don't want to lose their children. The decriminalization was never going to save a lot of lives in a short period of time, particularly when the illicit supply is so toxic. But it's a shift towards acknowledging, a critical shift in my view, towards acknowledging this is a health issue. Making people, arresting people, prosecuting people, jailing people, impacting people in such a way that they can't rebuild their lives because they don't have a job and they don't have a family and they don't have their children has not been helpful. And we've certainly seen that over the last number of decades. So as I said, criminalization and stigma lead many to hide their use. And as Dr. Henry said in her decriminalization report way back in 2019, I think it was, if the intention of a prohibition-based system was to protect individuals from harms inherent to substance use, then this policy approach has significantly failed. And we can see that over 40,000 people have died in the last 8 years in our country, over 14,000 in British Columbia. So BC asked for an exemption because the federal government controls the Controlled Drugs and Substances Act. The federal government has control over criminal law, and that has been criminalized for decades. And BC said we would like an exemption for 3 years. So the exemption includes opioids, crack and powder cocaine, and methamphetamines, MDMA, which is commonly known as ecstasy, and that adults, so you have to be 19 or over, found in possession of any combination of those drugs, as long as it was under, there's 2.5 grams or less, would not be subject to criminal charges. And the Vancouver police reported recently that their arrests for possession have gone down dramatically. And the drugs wouldn't be seized. And we know that some of the police departments, in Vancouver being one of them, Victoria being another one, they weren't, for the most part, they weren't doing a lot of charging for simple possession, but they took people's drugs, which just meant a boon to the drug traffickers. People went back to buy more drugs. And if they'd had those drugs tested already and they knew they were safe, or they tried a little bit and now they go back to the poison well. So really an ineffective way to keep people safe. It doesn't apply at schools or childcare centers or within drugs, or when the drugs are within reach while operating a motor vehicle or watercraft. So there are some pretty thoughtful restrictions around it. Doesn't apply within 15 meters of skate parks, play structures and playgrounds, wading pools and spray pools. So 15 meters, you can't have any of them, even though they're legal outside of that, but around those areas, you can't have them. And not on same as private property, shopping malls, bars and cafes, where the owner doesn't want to see the drug use. And anything, any of it is illegal at an airport. You can't have it at an airport. So this was what the province put out about what would change, exactly what I just said. The initial request was for 2.5 each, but then the province had a change of heart and reduced it to 2.5 total, which really concerned a lot of folks with living experience, because those who are really challenged with those limits are people in rural communities who have to travel a long way to get their substances, or buying for more, 2 or 3 or more people. Really, the decriminalization wouldn't apply to them because they would have too much on board. So, but the challenge of change with decriminalization is there's a lot of fear. It feels dangerous. We think the drugs are dangerous. Why would we decriminalize them? And that makes sense. Except that we realize that for decades now, criminalization has made things worse. The drugs are there. People are using them. We haven't built up the treatment. We haven't built up the harm reduction services. We haven't done enough focus on prevention, except, to scare people by the threat of arrest. So all of those services, massive dearth. And so arresting people was the response. It hasn't worked. We know that 40,000 people died in our country. We know that that hasn't been successful. So the intention of decriminalization or safer supply are not to promote substance use. I'm going to talk a little bit about that in a minute, but it does recognize that people are using substances. And so, as chief coroner, I have seen so many people die in so many different ways. And I don't think substance use is a good thing. I don't think heavy alcohol use is a good thing. I've seen many, many, many deaths, thousands of deaths in our province related to alcohol use, smoking. All of these things have health risks, but prohibiting them has not made them safer. So I just wanted to take you a really brief look at the criminalization and decriminalization of people who use drugs. 1908 was the Opium Act. If you've read any of the history around the Opium Act, it was very racist. It was really in response to people from China who were here and working, and opium was often used traditionally in ceremonies, but fear. It was different. We didn't know it. We're going to ban it. I'm really simplifying this. And then 1911, harsher penalties. Narcotic Control Act continued to focus on criminalizing. In 1994, after a significant increase in heroin deaths, the Office of the Chief Coroner did a review across the province, recommended way back then consideration of decriminalizing possession, saying it's not helping, it's just making things worse. There was expert opinion in 1996 from the Dane Commission to remove the harsh penalties for drug possession and legalize cannabis. And in 2018, the Cannabis Act did legalize possession for cannabis. Not in recognizing that, it doesn't recognize that cannabis use is safe. And I think that's what people have to, there are still risks associated with cannabis use. There are risks associated with alcohol use. There are risks associated with smoking, tobacco. But all of those things are legal. And then we approach those health risks in a different way, in a supportive way, in providing information, providing programs, not punishing, not arresting. And this is the paradigm of prohibition, and this is something that the Health Officers Council of BC developed a few years ago. And I find it really helpful in helping to understand this, because it is a little bit challenging to sometimes get your head around. Prohibition, significant negative impacts when people are using something that's prohibited. It's like when alcohol was prohibited in Canada. People still drank alcohol. They just got it by illicit means. There was rum running across to the States. There was alcohol being made in stills, and people. There was an article in the province this week, apparently, about how that was happening here in Vancouver. People made a lot of money off it. There are significant harms associated with prohibition, with prohibiting something that people are doing, because it becomes illicit, because it's now made by those profit. It's done for profit. The conditions under which it's made are not regulated, can be very dangerous. So then you get to de facto decriminalization where we are now. Public health regulation was where the public health officers thought we should land with substance use. And then goes the other way. Prescription, legalized with few restrictions, or legalize and promote. If you look at alcohol, that's where we are with alcohol. And the impacts are tremendous. The health impacts of alcohol in our country are in the billions of dollars, far more than the impacts of drug use. But alcohol is something that everybody wants to use, which is fine. But the promotion of alcohol has caused huge harms. And I'll show you, I have a slide a little bit further on that shows you some of the hypocrisy that I see around that. So the government, in response to the recommendations, really didn't do much in response to any of the recommendations that have come from any of those committees. The drug poisoning deaths continue to increase. The unregulated drug supply, increasingly toxic, primary driver of the increased deaths. The medical model for provision of safer supply, the 2021 directive, faced a number of overwhelming challenges, not the least of which is that 1 million people in our province don't have a family doctor. So where do we find physicians to prescribe to the estimated 225,000 people in our province who are using illicit substances? 100,000 people in our province are estimated to have an opioid use disorder. Fewer than 5,000 people have access to safer supply. So it's simple math. We simply can't, in the prescriber model, meet the needs of all of those at risk, the 225,000 people at risk. And so the panel recommended a non-prescribed approach. Government rejected it pretty quickly, but recommended that the government engage with people with lived and living experience and their family in the process of planning what will work, what will help, fund, support, and engage with Indigenous leadership to identify Indigenous solutions to this crisis, but also continue to do the other things, continue to build up the treatment, expand harm reduction measures, safer supply, locations for people to use substances in a safe way in front of, well, not in a safe way, but in an environment where if they get into trouble, somebody's there to help reverse it. And continue to work on prevention. Don't stop doing any of those things. Those are all things that need to happen. Many, many people are looking for treatment and just can't access it and are dying waiting for treatment. But in the meantime, provide a safer supply. They can't go into treatment if they're dead. It's a really bald statement. But with the current state in our country, and it's not just BC, Alberta has adopted very much a treatment-only model. They don't have very much harm reduction. They're closing overdose prevention sites, and they will not consider safer supply. And while their rate of death in Alberta is less than BC's, it is growing at a far faster rate. So this crisis has kind of gone Ontario, BC, and then moved inwards across the country. So they are experiencing the same challenge. This is Guy Felicella. Maybe some of you know Guy or have seen him speak. He is a person with lived experience. He is a Vancouverite who was involved in substance use for 30 years, went to jail numerous times, and he will tell you he died 6 times of toxic drug events and was brought back. And finally, the 7th time, he survived and he changed his life. And he's a huge advocate for harm reduction, for treatment, for evidence-based treatment services, for safer supply, for decriminalization, for respecting people who are suffering from this health challenge, this medical challenge. And his, sorry, I wanted to use his quote on regulated supply. This is why a regulated supply is so badly needed. Drug regulation isn't a radical idea. In fact, it's the role of governments to regulate substances to protect people. Governments do the same thing for other substances like alcohol and cannabis. They also do it for the food we eat. By regulating these consumer goods, distribution and access are controlled and limited as needed. Regulation means information. Like food labels, labels tell us what's inside, whether it's the alcohol volume in a bottle of wine, the levels of THC in a cannabis gummy, or the amount of fat in a bag of potato chips. Each of those goods can be dangerous, but the danger is mitigated by giving the consumer information. So again, not promoting drug use, not promoting alcohol use or cannabis use or tobacco use, but acknowledging that people do those things. So providing health information, providing supports, providing health services, but not not criminalizing and prohibiting substances that will then be provided through the illicit market. This is a recent act that the province has proposed. It's called Restricting Public Consumption of Illegal Substances Act, and it's quite controversial. So Premier Eby in the news release said, we want to help people feel safer in their communities. Solicitor General Farnworth said it makes sense that laws around public drug use be similar to those already in place for public smoking, alcohol, and cannabis. And if passed, this law will ban drug use in public and recreation focus spaces, including a 6-meter radius from building entrances, including businesses and residential buildings, 6 meters of a bus stop, 15 meters of playgrounds, spray and wading pools and skate parks, and at parks, beaches, and sports fields. Basically everywhere will be public drug use is prohibited. And on the face of it, you know, what the Solicitor General is saying seems reasonable. We do control where those other substances are used. But then if you think about it a little further, those substances are regulated. So if people buy them knowing what they're buying and knowing that if they use them in a responsible way, they can be used safely. You can drink a couple of beer or whatever you might drink, and you know that what's in that bottle is what you thought you were getting. We're not in a public health emergency for alcohol, although we should be probably, if you look at the harms associated, but we're not. But we're in a public health emergency for the toxic drug crisis. To implement this law in the middle of a public health emergency when the supply is toxic and there's been massive increase in homelessness across our province. So the people who are using drugs in public, they're not coming from the suburbs or coming down from their condos to use drugs in the streets, in the main streets of the towns. They're the people who are already homeless. They don't have anywhere else to use. If they go use in one of the small places that's not encompassed by this legislation, they will use alone and they will die. And it's ironic because that's one of the pieces of advice that we have been giving the provincial health officer and I, and the Ministry of Mental Health and Addictions. Don't use alone, don't use alone, don't go home and use alone. And yet what this law would do would force people to go and be out of sight and use alone. Nobody wants to see public drug use. Nobody does. But what is the solution? Is the solution a law that pushes them into corners where people who are using drugs into corners where they will die? Or is the solution coming up with regulated supply, safe consumption sites, overdose prevention sites, places for people to live? I mean, if you're social scientists, I don't have to tell you what all those challenges are. So the Harm Reduction Nurses Association challenged this law, and Chief Justice Hinkson, BC Supreme Court, said that unsatisfied that this legislation will cause irreparable harm. And so they got an injunction till the end of June. That law has not been proclaimed. And there's so many questions that I have about the need for the law. And I was asked about this many times as chief coroner. Do you support people using drugs in public? And people should feel safe in their communities. And I guess what I wanted to know is there a difference between feeling safe and being safe? It's not comfortable to see somebody smoking drugs on a park bench in your community. But does that make me less safe? But if I make them go and use in a back alley or behind a dumpster, are they less safe? That is a life or death situation for them. So it's really, I found the language of the news release really interesting. Help people feel safer, because there is no evidence, there is no data supports that people are less safe because of public drug use. It's not comfortable. We all acknowledge that, but what is the response that we want to have to that? So feeling safe versus being safe, and then public drug use versus public living space. And in my last media event before I retired, I gave some of the statistics around increases in homelessness. There's been a 32% increase in Vancouver, a 70% increase in Campbell River, which is one of the communities most heavily impacted by this crisis. Huge challenges for people to find housing. We all know that. We see them. And where do they use, if they are substance users and there's not treatment and there's not safer supply, we just don't give people any options, and that's why we see 7 people dying every day. I found this is the piece that I found kind of ironic, I guess is the term. This was from last April. Vancouver to allow alcohol consumption in select public plazas year-round. So this is that, where we saw the paradigm of prohibition, that promotion. So at the same time that, and I don't want to pick on any particular mayors, but we see certain people in Vancouver, public officials saying, we don't, too much drug use, we don't want this drug use, we got to have some law and order in the city, but we're going to allow more drinking in the plazas because that's a good thing. There's not a difference there. They are both substances that have the potential for causing serious health challenges and other outcomes. One is socially acceptable, one is not socially acceptable. Is it because one is legal and one is not legal? The stigma of so many years, there's so many different factors at play here. But I just thought it was really ironic that Vancouverites are allowed, this was the language of the news article, allowed to bring their own booze and drink outdoors, like party. We want to have fun, a city that's more fun is kind of the messaging that went aloud with it. But we got to clean up those people who use drugs. We got to get them out of sight. I take that so personally because those people who use drugs are our brothers and sisters and sons and daughters and friends and neighbors. They deserve to be looked after. They are just as important. So there was a statistic I found kind of interesting, because there's been a lot in the media of the failure of decrim. So decrim was implemented just over a year ago, and there are some political leaders who are saying it's a failure. From 2014 to 2022, when drugs were criminal, they still are everywhere in Canada except for BC, there was a 625% increase in deaths in British Columbia under the criminalization of drugs. From 2022 to the same period in 2023, so decrim happened January 31, 2022, the same period in 2023, there was a 7% increase in deaths. And yet decrim is the failure. It makes no sense. We're 1 year into a 3-year pilot. The drugs that people are using are still toxic. The criminalization was not effective. And it's hard to understand this desire to go back to something that wasn't effective, that caused so much harm, that ruined so many lives, that we saw so many deaths. But it's that fear, it's that drugs are bad, we've been told drugs are bad. And nobody's saying excessive drug use is not bad. Although opioids are used by lots of people across our province for really important reasons, pain control, palliative care patients, cancer patients, opioids are incredibly important and valuable drugs. Used recreationally, they can have harms, but what's the approach? prohibition has clearly not been helpful. So in conclusion, I'm going to sum up. 15,661 people have died since 2013 as a result of the unregulated illicit drug supply. 6 or 7 people die every single day in our province as a result of toxic drugs all over our province. It is the leading cause of death for those aged 10 to 59 in our province for 2 years in a row. An estimated 225,000 people use unregulated drugs in BC. All of those people are at risk of dying every single day, and fewer than 5,000 have access to safer supply. And around 4,300, as of the province's last data that came out in January, I believe fewer than 4,400 people have access to publicly funded treatment. It's necessary, but we're just not there yet. And while we wait to build up those systems, 6 or 7 people die every day. So I always want to end on a positive, the challenge of change. All of these people are heroes. There's Leslie McBain. Leslie and her friend Jennifer Howard founded Mums Stop the Harm. They have lost their children to this crisis. Jennifer lost her son in 2014, I think. Jordan died. Jennifer lost her son. All of these mums are working to prevent other mums from losing their children. They are just so heroic. Safe Supply, Not Left to Die, the community advocates. There's Guy with his wife and 3 children. People would have written Guy off. He was in and out of jail for 30 years for his drug. Guy is a wonderful person, a kind, caring person, but he used drugs, so that made him a criminal. He was in and out of jail for years. He's a massive success story. And these are the people who are using drugs. That's what it's so hard for those, I heard, and I don't want to offend anybody, but I heard Mr. Polyev in the House a few months ago, addicts. We want to talk about those addicts. Why would we help those addicts? And I just found the language so hateful. Why does it have to be so hateful? They are people who are struggling with a health condition or a medical issue. And those who advocate, and there's Leslie and all her mums, with holding crosses in remembrance of their sons that died. August 31st is International Overdose Awareness Day. In every community, Mums Stop the Harm hold rallies and gatherings and vigils, and I would encourage you to go to those. And let your representative know that you care about this. When people ask me what can we do, let the government know that you care about this, because the government polls, and they continually poll that they're doing a very poor job in response to this crisis. But it's not in people's top of mind in terms of what they want government to focus on, because unless it impacts your family, inflation is the thing. The cost of living. Can I pay my rent? Can I renew my mortgage? Those are what people care about. So these people are my heroes. Leslie calls them all warriors, and I think she's a warrior for sure herself. These are some of the references that I used. There's some great books out there. Ben Perrin, who's a law professor here at UBC, has written a really great book, Overdose, Heartbreak, and Hope. Johanne Hari, she's an American, but has done an excellent job on tracing the history of the narcotic laws in North America, more focused on the States, but very similar. And the bottom one there, this Getting to Tomorrow, SFU Drug Policy Coalition, I think they're called, has some excellent videos that are so really myth bust and challenge your perceptions. I highly recommend them to just get a better sense of this crisis and the history and the impacts. I know I could go on about this all day. Obviously, I feel very passionately about it. It is very frustrating to me that we watch these people, our loved ones, die day after day, week after week, month after month. And I feel that if they were dying from anything else, there would be a massive public health response. If they were dying from tainted alcohol or tainted Tylenol or tainted orange juice, heaven and earth would be moved to make sure that those deaths didn't happen. But because they're dying of drugs and there's so much stigma associated, it's been very lukewarm, and that won't change unless government understands that this is important to us and it really matters. So thank you so much for being here. I know it matters to you, or you wouldn't be here. And I know I was going too long, but I really appreciate your attention. Thank you.
Okay, well, thank you for what was profoundly disturbing but incredibly enlightening. Like, I thought I kind of knew about this, but realized there's an awful lot I didn't know. So thank you very much, and for your passion. I am disturbed by one thing. Do you have to retire? Because to know you're there would be very reassuring in many ways. We're actually at time. If you're okay to stay a little bit longer, I would invite anybody who needs to go to feel free to do that. But I suspect we won't have time for many questions, but I'm sure some of you are anxious to ask some questions. So I won't take many. I will ask you to speak loudly, and I will ask you to be concise in your questions.
Excuse me. Ms. Lapointe, I want to thank you very much. I also want to say that as a person who was in public office, how much I've admired the integrity and the skill with which you navigated the hazards of your office. And it's admirable to be both an advocate, but an advocacy that's coming from science. And that's where the credibility lies, and the way you can articulate that. The other part of that, of course, is navigating the shoals of politics, and you've alluded to some of that. I'm wondering now, if looking back, just months since you retired, what lessons have you taken from this in terms of a role, a person who's in the kind of public position you were in? Would you do things differently, or what advice would you have for anyone who's in a similar role? Thank you.
Thank you. That's a very insightful question. When the crisis was first declared by Dr. Perry Kendall, and at the time we were all working very closely with Terry Lake was then the provincial health minister, and he felt very passionately about this. And it was very much an all hands on deck. We are going to resolve this crisis. As the deaths continued and continued and continued, government was becoming increasingly uncomfortable with the data that we were sharing. And there was the Ministry of Mental Health and Addictions was well intentioned. It was intended to see. Premier Horgan at the time said, "New government, new ministry created. We will have somebody at the cabinet table representing mental health and substance use." But unfortunately, that ministry has really no budget. It's health, Ministry of Health, that administers the programs, the treatment, if I knew then what I know now, we would have had some serious conversations with government and the health minister, the provincial health officer, and I think carefully about this. Because in fact, it kind of, this is a hard word, this maybe not a good word, but I can't think of it. It ghettoized Ministry of Mental Health and Addictions. It kind of took it, that's another issue. It's not a health issue. It should be part of health. It's very much a health issue. Moving it to another ministry has not done it a service. Make alliances. So That's one of the things that I, was kind of, you get to a stage in your career, and I'm sure you must know that, where you've made so many alliances, you can just pick up a phone and get things done. And that was something that I really valued, the alliances that we formed with the First Nations Health Authority, the provincial health officers, all the medical health officers across the province. But it's really hard for the government right now in the face of this law and order kind of right wing, I don't want to get political, but this pushback that we're seeing, it's very, very hard. What I wish I had done, but I couldn't, is gone out to municipal councils across the province and offered to meet and sat down and given them an abbreviated and a little more objective presentation about this data, helped council by council by council understand. But when you're in government, I couldn't do that as chief coroner without going through my minister's office. You can't just go government to government without, but that's something we should have done more of, and we should have done more presentations to the legislature as a whole. I would do that much sooner and much more often if we had to do that again. Yeah.
Okay, we'll take one more quick question, and then we're going to have to wrap up.
I think,
I'll try to be quick.
I think we're getting recorded till 7, he said, but I don't know if that matters. Up to you. Okay. I don't want to mess
Does that mean
with
I
the
get to
boss.
ask a 40-minute question?
Go ahead.
No, I won't. Thank you so much for your presentation. I was hoping you could speak a little bit to the recommendation around non-prescribed safer supply. And I think I'm hoping with your retirement freedom that please get political. I think it's so important because I followed your report very closely, and the fact that recommendation was made 2 weeks, I think your report came out 2 weeks after the raid on the Drug User Liberation Front that was doing very successful grassroots-led non-prescribed safer supply. Then your report came out recommending exactly what they were shut down for doing, and then the government to just not even read the report and immediately shut it down. And I've seen numerous interviews with Jennifer Whiteside just won't even speak to it. And so I'm wondering if you can shed some insight on where that backlash comes from, and any advice from those of us that are advocating for it, how to try and get that message through.
What I see is government is trying to navigate a very almost invisible line right now. So there's the right law and order that has got some momentum in the country, and they don't want to offend anybody on that side. But there is a very clear acknowledgement from the Coroners Service death review panels, from the provincial health officer, Dr. Henry's also been very clear, from all of these committees, from the government's own health standing committee, that decriminalization needs to happen, that safer supply needs to happen. We will not see a reduction in deaths this year because the treatment options haven't expanded. They're still not evidence-based. And there's fewer than 5,000 people accessing safer supply. So what the panel said was have a regulated system of safer supply. Not at the stage yet where it's a drugstore like our liquor stores are, where anybody can go in and buy whatever they want. But for people who are at risk of dying as a result of their substance use, they could access it at a clinic in their community that's run by local health professionals, medical health professionals. So there would be some regulations. You would need to provide ID, a charge for those who can afford it, have a pay model. So I know there's a lot of pushback. Why would we provide free drugs for, I have to pay for my diabetes medication. Why would we provide free drugs? And that's not what the panel said. For those who can afford it, charge the same as the illicit market. So it's not cheaper, people can't buy it and then turn around and sell it, make a profit, but not more, so people will continue to charge the same as the illicit market. But government is very afraid right now, and I do understand that from a political level. If you're no longer government, you can't do anything. So they're trying to walk, from my perspective anyway, that fine line between appeasing those who are very concerned about public safety, very anti-decriminalization, very anti-safer supply. Well, they know in their hearts all these recommendations have been supporting safer supply, supporting decrim. So that's where they are right now. So they're very, for a long time they stopped talking about safer supply at all. So I was very grateful that they're now talking about safer supply again. But I don't think we're going to see any significant changes until after the next provincial election. And if this government is elected again, then they will be more courageous, in my opinion. Right now, all eyes in government are focused on the election. And that's a political answer, but that's the reality of this situation.
Okay, we can squeeze in one more quick one.
No, there's somebody in the back there. Behind you, Tim.
Hi, I was carefully following through your presentation. I have like a question. Like it might be contradicting, but like it's a personal opinion. So we talked about how, like you talked about how the like smoking was the most common way of using drugs, and then we talked about using drugs in public places, and then we talked about like feeling safe and being safe, and that drug usage didn't made anyone feel unsafe. But if I'm following through, if someone is smoking drugs in public and I am being experienced with that secondhand drug smoke, that makes me feel unsafe. So I should have the consent that I am not exposed to drugs through smoke, right? So what should be the policies regarding that, so that those people who do not want to get in contact with that are also safeguarded?
Yeah. So again, because there's no data, we don't know how many people were actually using drugs in public places that were putting other people at harm. There's no data gathered. There's no evidence supporting this law. There was a lot of public opinion that they didn't like the potential of people using drugs, and a lot of anecdotal evidence that they're seeing people use drugs. But I completely understand what you're saying. And in my mind, and as I said, nobody wants to see massive public drug use, including the people who are using drugs. They would much rather be using in a supervised consumption site that's nearby. They can't travel, miles and miles. That's around the corner. That's non-judgmental, that's safe, that also provides them with health information and nutrition if they need it. Supervised consumption sites, overdose prevention sites. So in my opinion, based on what I've seen over all the years, it's not who cares, let it go. We need to respond, but don't blame the victims. So the people who are smoking their drugs in public are smoking their drugs in public because they have nowhere else to go. They don't have a home. They're homeless, and they don't have anywhere to use safely. So safety in numbers, they're using with their friends in the park. And according to Guy, who lived in the downtown east side for years, nobody will smoke drugs around children. If they see a child coming down, word goes out, child in the presence, or child in the street, everybody stops, everybody's careful. Because this notion that drug users are unethical, this constant in the media portrayal of people who use drugs as unethical, evil, dangerous people. And they are people just like us who are using substances and sometimes have had really severe impacts from the poison that they've been using for a number of years. And you can see them, physical and mental health impacts. So it's not about, you're absolutely right, other people shouldn't be put at risk. And that's the challenge around the inhalation sites and why they've been taken so long to get established, because it costs more money to create an inhalation site where the workers aren't negatively impacted. But to my mind, the response is not to make them go hide in corners, but to implement a robust response that actually meets their needs and saves their lives too.
Okay, thank you. I'm afraid we're going to have to wrap up the question thing. I'm going to turn it over to Samir Ishmael, who's the president of the UN Association of Vancouver branch, to wrap us up.
Thank you. Okay, thank you so much, Lisa. I really appreciate you taking the time to speak to us today. And one thing that I did really want to mention is I really appreciated how much you used data in your presentation. And I mean, that's just me personally, but I think it just really demonstrated the impact that this crisis is having in BC. And I really appreciate all of the myth busting that you did. And I think it really just helped educate everyone here today and really shine a light on some of the policies that would really have a strong impact on us. So I did want to give you a gift bag on behalf of the UBC School of Social Work and UNAC Vancouver. So that's there
Thank you
for
so much. Thank you very much.
So everyone,
Very
please
kind.
give a round of applause to these folks.
Thanks. Thank you. Thank you.
So I do have a few thank yous, so please bear with me. So first, I'd like to acknowledge the staff at the UBC School of Social Work, in particular Professor Tim Staten, who has played an instrumental role in this event's success annually. And I also want to thank some of the admin staff at the School of Social Work as well, in particular Rita and Radhika, who have played a key role in organizing. So give them a round of applause as well. I'd also like to thank Patsy George from UNAC Vancouver, who has led the work on behalf of our organization, and who also has a long career in social policy and advocacy and has guided this event so well. So thank you, Patsy. And a final thank you to Dean Croston and Dr. Leah Corgata for joining us today as well. Thank you. So the United Nations Association in Canada Vancouver branch is really proud to take part in this event year after year, and we hope that you all enjoyed it and that we'll see you again next year. I personally, as a recent UBC Arts graduate, I'm also so proud to be able to represent our organization on campus here today. And thank you to all of the students who are attending, all of the members of the public. Please use this event as a way to really just find a call to action for yourself, whether that be contacting your local representative, as Lisa Lapointe mentioned, or joining an organization that is working to actively address this crisis. This is something that I think you can really use as a way to take this event and actually do something in your own lives moving forward to try and address the crisis in your own way. And with that, I wish you all a good evening, and we hope to see you again next year. Thank you.